Human Resources Chapter. Manpower, human resources, or talent management is an integral part of managing healthcare facilities. Human resources management had become a field of management with its own merit and distinction. Hence, a qualified personnel should lead and manage the human resources department. Shortcomings in this area may lead to unsafe care, resulting from fatigued staff, underdeveloped skills and competencies, and poor work environment. To ensure smooth service delivery, organizations' workforce management is done through multiple stages, starting from identifying the needs to recruitment and multiple processes to ensure retention and satisfaction of qualified and committed calibers. These two slides list what would be the scope of services for a human resources or talent management department. HR2 Departmental Staffing Plans. Prior to the development of staffing plans, Human Resources Department assists heads of departments by conducting job analysis and the identification of staffing needed to operate safely. Based on the department's scope of services, complexity of care, and workload statistics, staff qualifications, types, and numbers are identified. Manpower planning stems out of hospital strategic directions and advancements in the healthcare field that is growing more and more specialized. Hospitals today, just like any other business, compete to be the employer of choice of the highly qualified and specialized calibers. Human Resources Department and hospital leaders need to be ready and compete with the market. The main objectives of staff planning are ensure adequate budgetary needs, align with hospital strategies, and ensure critical roles are always filled with appropriate qualifications and experience. The standard is evaluated through review of departmental staffing plans during unit visits. A discussion with the head of departments is expected to reveal how the staffing plan was developed. Monitoring of deficiencies would be presented through staff retention or turnover data and the actions taken accordingly. In organizations where recruitment is centralized, this standard still applies and assignment of staff should be according to the identified needed talents and skills. A noted pitfall could be the inconsistencies between qualifications and experience in the job description and those in the staffing plan. HR5 addresses proper credentialing of staff. This is the only essential safety requirement we review in the leadership domain. Professionals responsible for direct medical and clinical care must be identified and applicable laws pertinent to their employment must be followed. The Ministry of Health and Saudi Commission for Healthcare Specialties have established registration and licensing requirements for healthcare professionals. Hospitals are expected to abide by those laws and regulations. As part of ensuring patient safety and ethical care delivery, hospitals must develop their credentialing process that includes verification of license, education, training, and experience. What is meant by training is the completion of programs that are related to staff technical functions, which may lead to influence their clinical privileges or job assignments, such as conducting or participating in moderate sedation. This slide lists the track records based on which hospitals will be surveyed for primary source verification. Hospitals may conduct their own verification process or may outsource it to an external agency. With the introduction of data flow in the kingdom, many hospitals depend on it. Hospitals need to use multiple means to ensure verification is done when initial attempt fails. Compliance to HR5 is verified by all surveyors during personnel file review activity. As leadership surveyors, we review the credentialing policy to ensure that it discusses all elements in the substandards. However, for the implementation, we check for the medical record staff, social workers, and we select randomly new hires in clinical areas. HR5 substandards have clear details on how the credentialing process should be. Just a note for HR 5.8, the receipt of payment sometimes presented in personnel files does not qualify to meet the requirements. The confirmatory sheet should detail the requirements being confirmed. Hospitals may wish to conduct part of the verification in-house, especially for experience. This must be clear in the policy and in the personnel file. HR 10, addressing staff training and education needs assessment. Similar to staff planning, training and development should stem from the strategic plan. Training should be relevant to the staff job requirements and career development to be beneficial for the department, the hospital, and the staff himself or herself. There are multiple dimensions based on which training needs are identified: advancement in information technology, expansion of scope of services, new regulations, to mention a few. It is important for those in supervisory positions to identify training needs based on specific job requirements as stated in the job descriptions. It is also vital that staff with identified training needs are prioritized to attend the relevant programs and to have it linked to their annual appraisal. Compliance to this standard can be verified through review of multiple records and documents. Some of those could be findings of surveys done for staff to identify their training needs in relation to their own job descriptions or assignments. When reviewing heads of departments' requests or recommendations for topics of training programs, ensure that a rationale or an objective is stated in order to link the topics to hospital or departmental goals. For HR 10.2.5, performance appraisal templates or forms should include identification for training needs. Ensure that they are trended and analyzed to prioritize training activities and to ensure that those activities reach the target audience. HR 11 addresses hospital support for continuing education for all staff members. Organization's excellence depends on the performance of its employees. In order to reach that excellence, investment in staff development is critical. Many employees choose to join organizations that will support advancement in their careers. Hospitals should have clear policy that explains its support for continuing education. It should reflect the number of education days and fairness for all staff categories. It should explain the financial support and how staff can access it. It should address in-house programs and external conferences and symposia. Heads of departments' role should be explained in the policy. This may include submitting periodic summary for training needs based on staff appraisals, incident report findings, and other triggers. The approved topics for in-house training should be gathered in an annual calendar.